All right. So right now we're going to do a quick introduction and orientation about the ADC Part 2 exam. And in this video, we'll be actually talking about the OSCE. We'll talk about what is exactly the components of the OSCE. We're not going to break it down into a lot of details because we are covering it in a lot of other lectures later on. So let's keep things simple and not overwhelm you guys. So the orientation to the ADC Part 2, we've got with the OSCE. Now before that, the ADC Part 2 is a 2-day exam. They have changed it multiple times. So over the 40 years plus, it used to be 6 days. It used to be on patients. It used to have Viva exam. Then they changed it. That was around my time. So around 2014, they decided to change the system into a 2-day system, but it was purely for technicals. And there was also a communication task, but it was only one case where basically you had to either deliver a diagnosis to a patient or work toward a consent or treatment plan a case, and it was pretty much mostly focused on the communication itself. But then back in 2017, 2018, and they started doing it in 2018. So July 2018 was the very first batch that they started this new system. It remained at the 2 days, but now they have made it into 1 day. That is a technical day. And then the other day, and then the other day is the OSCE day. So now with the technical day, I have done another video about it and explain a little bit more. I think it's just easier instead of being overwhelmed with a lot of things to separate it. Now with the OSCE day, what is usually required, you're going to have 2 components of the OSCE. You're going to have one that is the OSCE Communication, and then you're going to have an OSCE Skilled. Some call it clinical OSCE, some call it technical OSCE. It's pretty much the same. Some call it performance OSCE. They're all the same. The OSCE Communication is pretty much an interactive patient-dentist interview. It is not a Viva exam or an oral exam where you're being purely tested for knowledge and you just need to list topics or questions to your examiner. You are actually talking to a patient with no dental background whatsoever. Now, obviously, the patient is an actor. So the examiner is actually the one who is pretending or acting to be the patient, and he's acting as if he does not understand anything when it comes to dentistry. And your job is to deliver the information as simple and as straightforward as possible. But then because they are examiners and they are dentists who are testing you, they do expect proper knowledge, they expect correct information, and they do have rubrics to follow where they need to know if you actually know what's going on, if that makes sense. It's just exactly how it is with your patients. You have enough knowledge, you've studied, you've graduated dentistry, you're always up to date, you always read journals, you know the guidelines. Anything that you're recommending is evidence-based dentistry. And your job is to deliver that information as simple as you can to the patient so that the patient understands what you're trying to say, what's going on, and what's going to be the next step. So it's a 10-minute patient-dentist interview. So you will actually be going into a room where you're going to have your patient, which is the actor, who's the examiner, and you will be talking to that patient. The OSCE Communication involves 4 clusters in that category. In regards to the rubrics, I've also broke it down into another lecture where we'll be discussing about the handbook itself, how to interpret it, what's involved in it, and what kind of rubrics they are following. With the OSCE Skilled, it is also 10 minutes. However, it is not interactive. It's you and the mannequin, and you've got a specific task to do, and there will be an examiner inside the room to observe you. It can be sometimes a little bit intimidating. Some students have said, like, as literally as I can feel their breath on my neck, so it can be a little bit intimidating and stressful. But once you actually understand what's going on and you practice in that simulated environment, and this is what we focus mostly on, the hands-on component in the center, we really focus on this because in the end you need a simulated environment so that you actually don't try it for the first time in the exam, or when you do it like only once and you barely just want to, you barely get the chance to know exactly what kind of things that they're looking for. But that's not enough because you've got the infection control, the certain postures, the rubrics, and then obviously the stress management and the time management. So every single task is by itself a little bit too much at the beginning, but that's why the whole portal came into place. It's just too overwhelming. There's just too many things that we need to teach you guys, and even in the 3 weeks, hell, even in the 6 weeks, excuse my language, like it's just too much, too many things to discuss. So anyway, for now, 10-minute skilled task to perform a certain task, and that carries 2 clusters. With the OSCE Communication, we said that it has 4 clusters, and in that 4 clusters, you have the information gathering cluster, the diagnosis and management cluster, the clinical treatment and evaluation cluster, and the effective communication. Every cluster has 2 stations. So information gathering will have 2 stations. And when I say 2 stations, it's actually the cases. Now the cases, you're going to find it in your communication folder. So the communication folder has almost all of the cases that have come in the exam for the students. So information gathering has 2 stations or 2 cases, diagnosis and management has 2 stations, and clinical treatment and evaluation has 2 stations for the OSCE Communication, but it's actually a 6-station cluster. So I know it's a little bit now too much. So again, the clinical treatment and evaluation is the only cluster that actually has 6 stations. It has 2 stations that are communication cases, just like exactly the same cases that they come in the diagnosis and management, that they come in the information gathering. And then it has 4 stations that are the skilled OSCE or the technical OSCE or the performance OSCE. All right, makes sense. So information gathering 2 stations, diagnosis and management 2 stations, in clinical treatment and evaluation 6 stations. 2 stations are for the OSCE Communication, 4 stations is for the skilled OSCE. Then how come we have put effective communication? Well, effective communication is actually a cluster by itself that is being marked across the other clusters, which means it is kind of like a separate cluster, but you are actually being judged on the effective communication across all of the other clusters. So across the information gathering, the diagnosis management, and the clinical treatment evaluation. So it doesn't have any station for it, but it is marked and it is a separate cluster. In each station for the OSCE, you have 3-minute reading time. And then you have the 10-minute interview time with the patient. Remember, because now we're talking about the OSCE Communication, you're going to have 3 minutes to read your case, and then you have 10 minutes to interview your patient. And again, we get into that, into a lot more details once you actually start your in-center course. to show you exactly how the room and the setup and how to walk and how to enter and what to expect. So the points that are greatly taken into consideration when the examiners are marking. Now, when you are entering the room, it is, like we said, it is a patient interview. So you are sitting across two examiners. One examiner is acting as the patient, and he's the one who will be talking to you, and then another examiner will be sitting down and he will be having an iPad. Apparently the student said iPad, but remember, this is what's been heard of. It can change any time. So if you see them on a piece of paper now writing down, don't freak out. These things can change, but the concept is the same. They have a set of rubrics and they're going and crossing and seeing if you are actually covering these rubrics or not. The points that are being taken into consideration, it is mentioned in the handbook, maybe in the rubric itself, in the handbook itself, it doesn't put that much details into it, but trust me, it is between the lines, and this is what they pick up on. And this is something where it just, either it comes naturally or it comes acquired, but it takes a bit of time, and this is where you need to be guided properly, and that's where our job is. The practical knowledge, number one, everybody starts studying. Everybody starts hitting the books and start reading crazy as if they have a theory exam. It is completely different from part one. It is completely different from any theory exam. There is a difference between the books that we have to read. When we were back in dental school, I'm not sure about your degree, but you remember, like in our uni, let's say, the first 3 years were actually more into books. So we had microbiology, biology, physiology, chemistry. And then once we got into the end of year 3, into year 4 and year 5, it started becoming very clinical. So then we started having the restorative and the prosthodontics and the orthodontics. Year 3 was theory, and then year 4 and year 5 was pretty much a lot of practical. And then we were always being asked to read articles and do research and be updated into the most up-to-date journals and articles. So that's how you should be tackling this OSCE communication. It's practical knowledge, it's not theory, which means I would rather you reading dental magazines, scientific journals and articles, updated guidelines, checking the WHO organization, the WHO, ADA, whether even the American Dental Association, the Australian Dental Association, the British Dental Journal, the Australian Dental Journal, the most up-to-date references and articles. Those are the ones that actually help. Now, you don't have to know too much. You have to know enough. All right. So as a general dentist and as someone who you will be considered as a newly qualified dentist, so they will actually mark you as a person who just literally graduated from a local Australian university. They're not expecting you to know any specialist knowledge, any specialist level or too advanced level. They are expecting you to have enough knowledge, enough practical knowledge, and anything that you say is evidence-based, and for you to know as a newly competent dentist. I've put into this link, and this is in the handbook and it's in the ADC website. It's the professional competencies of a newly qualified Australian dentist. And that's exactly how they are judging you. So whatever it's required from these newly graduates, that's what's required from you. And just a tip, I will be discussing this also in another lecture when I discuss about this article. Sorry, I keep pressing. But just a tip for you, even when you pass, at the beginning, you are a newly qualified Australian dentist, which means as much experience as you have, just remember that the first 2 years, try to not do too much advanced procedures if you don't have enough experience, or you can back yourself with a lot of courses or a postgraduate degree. It's a good idea to take couple of courses, couple of CPD courses into the field that you want to start practicing, especially if you are a specialist, because once you register, you'll be registered as a general dentist, and that might take a time before you get used to just going back to the basic. All right, so just take that into consideration. Communication skills, and communication skills has nothing to do with English. It's not an OET exam. It's not an IELTS exam. They're not expecting perfect grammar and the best pronunciation and the best vocab. It just needs to be clear English. Patient can understand what you're trying to say. You're delivering the information in a good way. And also we will be having also a separate lecture about communication skills, because it's much more than just talking to a patient. Interpersonal skills, and it's pretty much the same. It's the personality, it's the way that you convey the information, it's how you deal with the patient. It's different when you deal with a child than when you're dealing with an elder patient, than when you're dealing with an uneducated, low socioeconomic patient, then you're dealing with an highly educated patient, or maybe even a colleague, a colleague or a specialist. So that's interpersonal skills, and it is a skill by itself, where a lot of people pay thousands of dollars to get any course for them to show them how to communicate with your patient, because we know once you pass on, or if you're already practicing in your country and you do a lot of full rehab, how many times do you think about, or you've already done courses for communication and interpersonal skills, so that you deliver treatment plan, so that you get the treatment plan acceptance, right? Because it's not something easy. You might acquire all of the clinical skills in the world, but then you're not having enough patients, or you're not having enough patients saying yes to you. So that's by itself a skill. Problem solving skills, you have to understand that once you pass this ADC, you're on your own pretty much. It's not like UK or Canada or America, where there is still an internship part of it, or you need to go to university again. That's it. Once you pass your ADC, congratulations, you're registered and you are allowed to practice. Obviously, after you pass your English test, but you are allowed to practice. There's nothing more. So obviously, they want to see someone with good problem solving skills. If they're having a difficult patient or a difficult situation, they know what to do. They know how to control the situation. They don't lose control. They don't say, oh my God, I don't know, and I'm freaking out. When you don't know, it's okay. I mean, obviously study hard and read and keep yourself educated, but we're all human beings. So if it comes to that point where you're just having a blank moment, tell your patient, I'm actually not quite sure, I apologize, I've actually can't remember exactly, and I don't want to give you wrong information, and I will check my guidelines, or I'll check with my colleague, I'll check with the specialist, I'll check with the GP. Just problem solving skills, guys. Okay, you're not expected to know everything. You're just expected to know enough and expected to know how to handle these situations. Independent clinical judgment. When we do the OSCEs, when we start doing the role plays and the live Zoom sessions, and I get a lot of questions sometimes, tell me the management for this case, or give me a template. What should I ask? I'm like, it doesn't work that way. It doesn't work that way, because number one, every single dentist will have their own treatment plan. I can present a case in front of you and have 5 or 10 dentists, and I guarantee you every single dentist will treatment plan the case completely different from the other. It's the set of skills that you have, the level of knowledge and experience that you have, and the situation of the patient. Sometimes we know that there's no such thing as ideal treatment plan. And again, I'm not going to get into too much details, because I will be doing another lecture about just treatment planning. But we know that it depends on the situation, it depends on the scenario, it depends on my patient's responses, it depends on financial resources of the patient, about maybe my level of expertise of or my material resources, so much that gets into it. It's all about that independent clinical judgment. So you need to keep yourself up to date, and you need to educate yourself. You know, even with me, I've taken so many courses, and at the moment I am enrolled in the membership of the Royal College of Australian Dental Surgery, and it was clearly written, and it happens in other courses too, that no one in ADA the same. If you go and read between the lines, no one will treatment plan for you. No one will tell you, oh, okay, so you have a tooth like that, go and extract it. I've had mentors from the ADA, I had mentors or a mentor from the membership, and I had before. They will never go and tell you, oh yeah, so you have this tooth, go and extract it, or yeah, do scale the same. Investigate, examine, what's the x-ray says, it's your case. I can help you in telling you, okay, if you've got a pocket of 6 millimeters, maybe better to refer to a specialist. If when you have like a difficult extraction, maybe it's better not to do it, but see what you decide. So it's all about that independent clinical judgment, and it's exactly the same in the OSCE. If you expect me to go and give you a template of answers to give, trust me, my friend, you are wrong. And they have actually been so aware of the students, especially lately, and they've actually mentioned that everybody seems to be rehearsing answers, and it seems to be like a script. And they've actually put an article on some tips on how to prepare for the exam, and how specifically do not rehearse answers. So please, it needs to be natural. It needs to come from you. You are the dentist. It's your call. Just don't go and say, like, don't give a wrong treatment. You know, you're a dentist. Just follow the guidelines. Don't go and say, oh, I'll give you Indon, when it's simply like a not even pain out of one, you know, like things like that. Obviously this is just an example, but just things like that. Cultural competency. We know that we live in a country that is multicultural, so you're going to find a lot of cultures, and you need to be aware of that. You need to know how to deal with different backgrounds and different cultures. Be respectful, try to be understanding, and just deal with this situation. Sometimes it might be uncomfortable for you or for the patient, because you're not able to communicate properly, or there's just a barrier of or clashes of cultures. You're saying something, well, you know, sometimes some cultures, they believe in I remember like reading an article, I think from a book, where in some country, their beauty or celebration of the girls growing up is when they hit 14, they extract all of the teeth. So you might actually find cultures like this. This is where your duty is not to judge, not to offend. Your duty is just to say, as a dentist, well, obviously it's against the guidelines. You need your natural teeth. It's more important. Don't go and just, you know, like, oh my God, what are you doing? This is unethical. You're harm, you know. Just be respectful and try to deal with the situation. In regards to ethical competency, pretty much the same, and it really deals with problems that arises between dental colleagues. There are a lot of cases in the OSCE Communication where, you know, a colleague of yours did a filling and now the patient's in pain, or you actually forgot to mention the crown and now the tooth is broken. So there's a lot of law and ethics. What would you do? How would you deal with it? You can't throw a colleague under the bus, but at the same time you have mandatory reporting. Again, this is something like we'll discuss in another lecture, hopefully when we have time. But there's a lot that goes in than just reading some books and then pretty much talking to the patient. And professional behavior, it's all about your behavior. It's about your confidence. It's about how you're presenting yourself. Remember, you are a dentist. And once they give you that certificate, that's it. There's no internship, there's no supervision, no one will be in the clinic with you. It's all on you. And Australia has such high standards. And unfortunately, I mean, it's in a good way for public safety, but it has become a little bit too much, and a lot of dentists have started complaining that the dental board in APRA is just too strict, and it's putting a lot of stress on the dentists, and it's putting a lot of stress where you feel demotivated. You don't want to do treatments anymore because as simple as a filling, you might get sued. Or you might get a complaint, and by the time they say, well, you haven't done any wrong, it takes months and years sometimes of investigation, sending records, sending stereo records and logbooks, and they're bound to find something. And even when they don't, it's just that hassle, the thinking, talking to indemnity insurance. So just remember, this is what they're looking for. They're looking for a professional behavior from a dentist where they feel this dentist is safe, they're professional, they're competent, they're confident. I feel comfortable giving them the certificate. I feel comfortable that this, once they pass, they actually know what they're going to be doing. The topics or subjects that come in the exam, it's about, so read about periodontics, pediatrics or periodontics, dental traumatology, oral surgery, oral medicine, oral pathology, restorative prosthodontics, endodontics, drugs, and pain management too, preventive dentistry like fluoride, minimal invasive techniques, and dental legal matters. With the dental legal matters, maybe it's a little bit difficult for you guys to read about it, and this is where we will be discussing a lot in the Zoom sessions, the actual part of your courses, because it's a little bit difficult, and you actually need someone who's registered and been practicing and know what's going on. It's not as easy as it may sound. So basically the main book, and again, I will be posting something about like exactly the list, recommended like books and articles to read, but trust me on this, it's mainly your TG. Like whatever your TG says, you follow it. Now, I recorded this lecture. Today is 14th of January 2020. And that means literally just 2 weeks ago, TG has announced a new edition, the 3rd edition for TG. And at the moment, ADC has advised everybody to follow the old version, which is edition number 2. But remember, because now this is going to be uploaded in the portal, and it will hopefully remain for months and years to come until we have to update it. I really hope that I don't have to update it quite frequently, but ADC sometimes changes the system, so we need to keep updating as we go. So for now, anybody who's doing February, March, May, June 2020, for now, I'm talking about, it's 14th of January 2020, you follow version 2. If they announce anything, then we will announce on the website and through our communication channels. Okay, so you've got your TG, and then you've got articles and journals about these subjects. Again, clinical, practical knowledge. Read, don't study, don't memorize. Basically, the memorization will come in like about drugs. You have to know amoxicillin 3 times a day, 500 milligram, blah blah blah, but that's pretty much it. Everything else is just like read and update yourself and make sure that you are up to date. It's better than books. Books are good for theory, they're not good for the practical. In regards to the skilled OSCE, you have two clusters. One cluster is infection control. Now, here's the thing. Infection control is still being judged across the technical day. That's the other day that we'll be discussing about. And in regards to the skilled OSCE, the OSCE communication, there is no infection control because it's pretty much just an interview. But with the skilled OSCE, there is infection control. And in the handbook, it's a little bit tricky, but they do specifically mention infection control with the skilled OSCE, and we have heard a lot of people failing infection control and failing skilled OSCE, and it was relating to each other. It doesn't mean that they're not following infection control on a technical day. We're just saying it looks like it carries a higher mark in the skilled OSCE. So it is a cluster, but again, infection control is like the effective communication. It's a separate cluster. There is no stations. There's no specific task. It's being marked across all of the other tasks and all of the other clusters. You need to pass every single cluster, those 7 clusters. You need to pass every single cluster to pass the exam. There's a lot of people who pass every single cluster but the infection control cluster, and they fail the whole exam. Literally, I have seen people only 2 stations they have failed, which is in the skilled OSCE, and then they failed infection control and they failed the whole exam. Sometimes one station can drag you and fail you. And again, there is another lecture or another video to talk about rubrics. So please be careful, and all of this will be discussed into boring details in the in-center course, because there's just too much to give. The other cluster is the clinical treatment and evaluation. So remember the communication cases? So do you remember how we said in the clinical treatment and evaluation cluster, there's 2 stations for the communication cases? Well, here you go, the other 4 stations, because we said clinical treatment evaluation has 6 stations. 2 stations are the communication cases, then you have 4 stations that are actually for the skilled OSCE. All right, so with the skilled OSCE, you've got 3 minutes, the same 3 minutes for reading the task, and then you've got 10 minutes to perform the task. Vigilant, infection control, observation. Literally, they'll be looking at everything. The examiner is present in the room to observe all of the tasks that used to be unobserved in some period of time when they just started the exam. Now it's fully observed, and there is cameras on top of that. So you are literally being looked from every single angle. 4 stations in total, and it comes from a bank of tasks that come for skilled OSCE. Now, this bank of tasks, or the list of tasks that come in the exam, you've got scaling and route planning that you will be required to do it on a mannequin. You can get extraction. You're required to extract a tooth on a mannequin. Technically speaking, you don't really extract the whole tooth. You need to just show the performance, but again, they keep changing. We'll always update you, and we discuss this into details in the center. X-ray taking on a mannequin, there's a lot of specific clinical scenarios that usually come, and if this scenario comes, you have to pick this. If this scenario comes, you have to pick that. That's also in center. Matrix band placement, you literally will be asked, they give you a TOEFL Maya in a matrix band, and they say, well, put the matrix band on the mannequin, on a specific tooth, for a tooth, like you're doing restoration. It seems so simple, but believe it or not, there's rubrics involved in it, and then they look at it and they give you 10 minutes to do it. And some students freak out and actually they fail the task. Fissure seal, also you're required to do fissure seal on the mannequin, CPR, or performing medical emergency management. So far it has come CPR and syncope, like a patient fainting. A little bit different because with the CPR, the patient is completely unresponsive, unconscious and not breathing. With the syncope, it's like patient literally just fainted, and you just need to put them back in supine, and they'll immediately wake up. So just read again. TG is lovely. It explains about this, but if you want to get into more detail, we do cover this in the center too. If you like to also go and get a first aid like a one-day course for the first aid or the CPR, you can also do that. There's no harm. You're a dentist in the end. You need this. You need to keep being up to date. Some companies actually ask you for the first aid certificate before they hire you. So why not doing it? Worth the money. Local administration, so LA, you're expected to administer LA, can be a block, can be infiltration, rubber dam placement on a mannequin, again, clinical scenario, and you need to do rubber dam on the mannequin. In the past, it has come RPD and to write an OPG, but it hasn't come in a year or so. So we don't really know if they will bring it back or not. I just thought it's worthwhile mentioning it, just to keep in mind that if they ever do return it back, that at least you're not surprised completely. Remember, 4 tasks out of these will come for each student. So you're not expected to do all these tasks on your skilled OSCE day. You will be picked, like some people will get scaling and X-ray, Fisher seal, and LA, let's say. And some people will get like X-ray, matrix band, rubber dam, and perio. Scaling. So you're going to get 4 out of these tasks. The OSCE day in general is total 3 hours. 3 hours. So in total now you've got 10 stations. There is, how many clusters so far? So how many clusters? 5 clusters in total, including OSCE Communication and Skilled OSCE. And it's 10 stations in total. 6 stations will be for the OSCE Communication. So 6 OSCE Communication cases and 4 Skilled OSCE, and 3 hours in total for the OSCE. 6 hours for the technical day, but we will discuss it in another lecture. Okay, so exam OSCE sets. Guys, this is what you're going to find these numbers. It's from the OSCE Communication folder that we have given all of our candidates, the E-DENTA candidates. This is not for you to memorize. This is not for you to follow blindly. This is what's coming in the exam. It's usually coming in sets. These are the cases combination that usually come, like clinical information and gathering. Some exams have had, for station 1, they had case number 9. For station 2, they had case number 4. And you'll understand what these cases mean when you open the OSCE Communication folder. But does that mean I'm only going to practice like case 9 and case 4, case 13? No, you practice all of the cases. They have come, they keep changing the scenarios. Literally one OSCE can have like 10, 15 variations. That's why OSCE will never end. We will never be able to teach you OSCE truly in a comprehensive way, even if I teach you for the next year. That's where the portal has come from. We're trying to upload as much as we can. We're going to keep updating with a lot of resources, but remember, OSCE is pretty much you're teaching 5 years worth of dentistry into a 2-day exam or a 1-day exam for the OSCE. Sorry. So in the end, you are a dentist, you've graduated, you know dentistry. I hope that you at least you know the basics. And this is just a way for us to help you out in explaining how, like, some of the sets that have come, do not rely completely on the sets, do not memorize cases. This is just a reference, all right? A little tip to help you know what kind of the way like the sets are coming. All right, so I am going to be quiet now, basically, and I will give you a break, and I'll see you in the lecture. Good luck, guys, and see you soon.